Welcome everyone for this year's first of our webinar series. Uh, and afterwards, maybe we should talk about getting CEU credit before I forget. To get CEUs, you'll have to go back in and take a quiz. And perhaps Stan or Steve, you can describe that process a little bit better than I can.
Just go back to the website and log in, whichever ID that you logged in with. Go back there and click on the link. It should say, take the quiz. You can email stan@rxsober.org.
Okay, very good. So what we're talking about is part one. How do you integrate or infuse the topic of problem gambling and the impact of gambling on recovery into treatment for folks coming in primarily for a substance use or a mental health disorder? We'll talk about basically real quickly the terms, what we're talking about in terms of gambling, problem gambling, disordered gambling, some evidence on why do we even bother talking about how to integrate this or dealing with the impact of gambling. Look at some current practices, how they work or how they don't work, and developing appropriate and effective ways of addressing this issue in substance use and mental health settings. So this is us, the Center of Excellence. It's our mission to do everything regarding problem gambling and gambling awareness, prevention, treatment, policy, research. That's what we're about, to really help not stop gambling, not stop problem gambling, but to minimize the harm created by gambling and help everybody in the state of Maryland make the best informed decisions about the role of gambling in their personal lives, in their families, in their communities. So question, and you can write your answer in the chat or you can speak up. What percentage of adults have gambled either in the past year or in their lifetime in the great state of Maryland? What would people say? What percentage of adults in this state have gambled? 70%? I see a couple of 70s. Any other guesses?
At least 50, so.
At least 50. Other guesses? 90% of adults have gambled. So this is clearly a very normative activity, and that includes, you know, buying your lottery tickets, buying raffle tickets, and we'll talk about that whole gamut of what's considered gambling. So if you bet on a horse, that's gambling. If you bet you can make 3 spades, that's recreation or entertainment. If you bet cotton will go up 3 points, that's business. If you play bingo at your church, that's charity. What's the difference? Well, bottom line is there is none. Although people perceive all of these things as these statements show in very different ways. And often people don't categorize certain things as gambling. One definition we use is that gambling is any activity or game where you risk something of value or money on an outcome that's not guaranteed. So when I say something of value, what do folks think of as something of value that might be wagered that isn't money? What else do you put on the line of value?
Well, I'm an addictions counselor, so we hear a lot of people gambling with drugs or alcohol.
Yeah, absolutely. And you know, often people gamble with drugs or alcohol just to gamble, or they gamble to get the money to buy the drugs or the alcohol. So it becomes a very circular kind of process, and you stop thinking about which came first, and it's all intertwined. Yeah. But what else do you have of value that you might wager? What's of value to you in your life?
Clothes, TV, really any personal belongings.
Yeah. How about relationships?
Oh, never thought about that.
Yeah. Time. You know? Yeah, those are valuable things and commodities. And so, really expanding that definition to understand what people are putting on the line in terms of how much time they're spending. So using money as the marker of whether somebody has a gambling problem, that's just a small aspect of it. Money is often the least significant factor in determining how severe a person's problem may be. How many adults in Maryland have a gambling problem? I just heard the new census, there's about just shy of 6 million people in Maryland. So how many adults in Maryland have a gambling problem? We talked about 90% of adults in Maryland gamble. How many have a problem? It's like a lot of people drink alcoholic beverages. How many of those have a problem with their drinking? So how many people have a gambling problem in Maryland? What number would you guess?
When I go to 7-Eleven, everybody seems to be buying tickets,
Yeah, it's like you go to the bar and everybody's drinking,
Right.
So what does this represent? Everybody knows this. It's not quite the season for it. I probably should have switched to, Orioles Stadium, but
No,
this
basketball.
or basketball, absolutely. But since the Terps aren't in it anymore, we don't want to even think about that. So what's the capacity of Raven Stadium? See, you get trivia information on this webinar as well.
I have no idea.
Anybody have a guess?
About 65,000 people.
Close, yeah. Capacity about 71,000. So if you fill the stadium up twice, that's about 142,000. That's less than the approximate 150,000 adult problem gamblers in Maryland. And more than double that classify as being at risk, and that's according to a prevalence survey done in 2010. The next impact study is due to be done after we build our casino down in Prince George's County. But, when you look at that, that's a whole lot of folks. What percentage of those do you think are asking for help? That would probably be these people standing here along the sideline. If you were going to put it in perspective. A lot of people having problems in Maryland and throughout the country, and a very low percentage of those seeking help. Between 1 and 5% of the potential people having problems actually seek help for this disorder for a whole range of reasons, but the most recent research indicates that the most significant reason people don't get help for their gambling problem is shame. A huge factor and obstacle in people reaching out and admitting their problem.
What do you mean by shame, Lori?
They are ashamed that their gambling is out of control and they can't control it. So when research has been done and given people options saying, gee, you have this problem, why haven't you gotten any help with it? The primary reason they state is that internal reason of feeling shameful and guilty about the problem. And I think that's one of the chief differences between substance use and gambling. Most people these days understand that if I take in some of these substances, alcohol, certain drugs, it changes my chemistry and I behave in ways I wouldn't otherwise behave. So I can attribute my bad, evil, rotten behavior to this substance that does terrible things to my brain. People don't understand gambling in that way. It's just something I'm doing. I'm not putting in toxic substances that are going to affect my brain. And they really have a so much harder time understanding that gambling affects the brain in the same way, creating internal neurochemical changes um, that deprive people of, quote, free will in the same way that substances would. But it just doesn't compute to people who have the problem or their friends, families, employers, and the rest of the community. So that sense of this is just me doing this stuff and it's about me. It's not just even my behavior, which I feel guilty about. There's something inherently wrong with me that would allow me to do these things. So that sense of shame goes much deeper, I think, for gambling than substance use disorders.
Mm-hmm.
This picture is about, we've talked about adults, but young people are also susceptible. You know, a couple of Christmases ago, sets of poker cards and poker chips were, you know, one of the favorite Christmas presents for kids age 10 to 11 and older. And kids learn to gamble very early, like the little baby here sitting in, you know, his or her mom's lap holding the cards, or being given lottery tickets as birthday gifts or Christmas presents. And there's a whole campaign from the National Council and the folks at the youth center at McGill University every Christmas about lottery tickets aren't appropriate gifts for kids. You know, but this has been going on for a long time. Kids playing dice, you know, on the corners, in the school lavatories, you know, wherever. So gambling is going to be a part of it. And we need to get that word out that it's an activity that has risk associated with it.
Yes, well, Lori,
Mm-hmm.
I have grandsons and we play poker. So what
Yeah.
do you think about that?
There's nothing wrong with it, you know, but parents and adult family members need to realize that, you know, this is potentially risky and provide information about that. And maybe if you play poker, don't play it for money, or if you play it for money, all the winnings, all the pot goes into a big bowl that you save for a family activity rather than one person winning all the money.
Right, right,
So you figure out ways to reduce the risk for kids and educate them on the risks involved and what the warning signs might be and things like that. We talk about, you know, with kids, you have to have the talk, and March is Problem Gambling Awareness Month. And the theme this year is have the conversation. So parents need to have that talk with their kids, and you know, parents and school people think, oh, but they have to have the talk about risky sex, and they have to have the talk about alcohol, and the talk about drugs, and the talk about bullying, and the talk about stranger danger, and the talk about, you know, appropriate touching. And I don't want to have one more talk. But it's an important talk because gambling starts earlier than most of these other risky behaviors and is connected to all these other risky behaviors for kids. So it's part of
right.
the whole picture of what kids can be vulnerable to. And youth prevalence findings show that young people have higher rates. You know, that 150,000 adults in Maryland represents about 1.5, 2% of the population. That's probably standard. 1 to 3% of adults seem to meet criteria for having a gambling disorder, the highest level of gambling problems. With kids, you multiply that, so it may be 4 to 8% of adolescents show up as in that probable pathological or disordered gambling range. And a lot more at risk, 10 to 15% at risk. In Maryland, that's estimated at 50,000 kids. That's a lot of kids.
Wow. You're saying 50,000 kids have a gambling problem?
Yes, are exhibiting some form of problematic gambling. I know, and Carl, who's our prevention coordinator, goes into the schools and tells me all the time about how much these kids know about gambling. And parents think they don't, and that's not an issue. The kids know more about gambling than many adults know about gambling. And one of Carl's favorite stories is about the kid in one of his Smart Choices programs who talked about, well, we bet doing homework, something of value, my effort, my work, my smarts, you know, whatever it is, you know. So kids find other things to gamble even if they don't have money. So let's go ahead and talk about some of these terms I've been throwing around. We've talked about gambling and what that's about. Gambling disorder is the current terminology in the most recent Diagnostic and Statistical Manual. It's reorganized under substance-related and addictive disorders. We'll talk a bit more about that. It used to be called pathological gambling in previous DSM, so you see that term, that's the old diagnostic label. Problem gambling, we've never had a established category or a DSM category comparable to substance abuse. So we've talked about problem gambling in the field in similar ways that folks in substance use talk about substance abuse, characterized by some out of control difficulty setting limits on money or time spent gambling, or having some adverse consequences. And then a category that I think is really interesting to looking at population vulnerability and who might be, you know, a target group for prevention efforts are those at-risk gamblers, evidencing some negative consequences but no loss of control, or some loss of control but not yet having many adverse consequences, or low-key adverse consequences. You know, maybe they missed one appointment or some appointments, but nothing that's really devastating their lives yet. Or a little bit of loss of control, just always going a bit beyond their budget, but nothing that seems at a level to meet diagnostic criteria. Or they're just gambling at a higher frequency than the average person. And in some studies, that's been pretty low level, gambling up to 5 times a year or more. One researcher told me that their mean is gambling once a month or more. So, you know, lower levels than you might anticipate put people into that at-risk category. Recreational gamblers are what we use kind of to refer to those folks who can gamble without any significant problems or loss of control. So that's kind of the terminology. In DSM-4, gambling was categorized in what I call the island of misfit diagnoses, impulse control disorders not elsewhere specified. So everything nobody knew what to do with. So it included kleptomania, pyromania, intermittent explosive disorder, hair pulling or trichotillomania, and pathological gambling. And we were there since 1980 up until 2014. Now, as I said, we're reclassified because we established the research to show this is the best fit. We share many characteristics with substance use disorders, and we're the first and only behavioral addiction, non-substance related addiction, to be in this category, and it was renamed gambling disorder, and some of the criteria were changed. So currently, 4 or more of the following in a 12-month period. That 12-month period is new to DSM-5. In DSM-4, you could have met the criteria over the course of your whole lifetime, which was somewhat problematic. So needing to gamble with increasing amounts of money is the tolerance criteria. And it's not just increasing amounts of money, it may be needing to gamble and taking increasing amounts of risk. As you go through a gambling disorder, you may end up with a whole lot less money than you started out with. But of that money you have available, you may be taking bigger risks to get the same effect. And for some people, it's excitement. For other people, it's numbing out and becoming oblivious. So for some people it can be like cocaine and you get that big rush. For other people it may be like heroin and you just get totally zoned out, dissociated, things like that. Restlessness or irritability or other kinds of withdrawal symptoms that may include actual physiological symptoms like nausea, dry heaves, headaches, muscle aches, sleeplessness. It's more variable than substances, but often people report a lot of withdrawal kinds of symptoms. Repeated attempts to control, that's that loss of control criteria. Preoccupation, thinking of ways to gamble, of systems that are going to work better, of how to get money, of how to pay back the debt. So, most of your focus in life becomes focused around gambling and gambling related issues. Gambling as a form of relief and escape, to relieve distressed feelings. So somebody who may start out feeling depressed gambles and it seems to relieve the depression. Or I've had people who had panic attacks, but when they were gambling, they never felt anxious. So at first it seems like a cure. It just adds to those problems as you go along, unfortunately, but people cling to that as their only solution. And this next one, chasing, is rather unique to gambling, going back to get even, to get back your money, so that after a while the only way to get out of the financial crunch seems to be gambling. I had one attorney tell me, who owed about $250,000 and was into the IRS for that much money, that the only way he ever thought he could get out was by continuing to gamble. Even though you see that you just keep losing, it just doesn't seem rational to stop. Lying to conceal the involvement with gambling, the negative consequences criteria, jeopardizing relationships, jobs, educational, career opportunities, and bailouts, number 9, relying on others to provide money to get out of the financial desperation caused by the gambling. The one criteria that was eliminated from DSM-4 was committing illegal acts. It was the least endorsed item and endorsed only by those with the most severe gambling. And when people have begun doing some research on these criteria, the elimination of that one doesn't really seem to decrease the ability to make the diagnosis. And it used to be you had to meet 5 criteria, now it's only 4, and that does seem to improve the accuracy of making the diagnosis. An exclusion criteria is still that the gambling is not better explained by a manic episode. Not better explained is key, because you can have a bipolar disorder and also have a gambling disorder, and that's fairly common. It's been very, very, very rare in my experience that I see somebody who comes in for a gambling problem who really is only gambling because of being in a manic episode. I think I've seen in my 30 years of doing this about 2 people who met that exclusion criteria. More often, people have been misdiagnosed as bipolar because they've gone in and they've only been asked about mood swings, and the mood swings of gambling sound a lot like bipolar disorder. And if the treatment provider doesn't also ask about gambling, they'll misdiagnose a bipolar disorder. There are currently specifiers that weren't in the previous DSMs. Episodic, which is kind of like binge drinking. So somebody may go to Vegas once a year for their annual conference, blow all their money and get into huge debt, and then never gamble for the rest of the year. Still a problem. Persistent is just kind of continuous gambling over the course of several years, and you can have early or sustained remission, and severity ratings for the first time, based on how many of the DSM criteria you meet. Notice that they start with 4. So we're still talking about starting at the level of what used to be substance dependence rather than substance abuse. So severity starts with kind of mild dependence, not an abuse category. Differential diagnosis, I love this. Somebody who's a professional gambler. They are out there. Are they a high-risk group? Yes, but they do it very disciplined, as opposed to that loss of control. They set their limits in terms of time and money and stick to them. They keep records, they pay taxes, and they may earn a modest income. Not many, millionaire professional gamblers out there. We mentioned manic episode and explained that before. Also, personality disorders. In previous DSMs, a rule out was antisocial personality, but again, you can have both antisocial and problem gambling. Not all that common, but folks with antisocial can be at higher risk for a gambling disorder because it becomes part of their lifestyle. And other medical conditions. And does anybody know what medical conditions might put somebody at higher risk for a gambling disorder? Yes, very good, very good. Parkinson's and restless leg syndrome. And it's called something muscular disorder these days. I keep forgetting that new name. But it's the medications for those disorders, the dopaminergic medications that trigger disinhibited behavior, and out of control gambling can be one of those. And need to make sure that you address the medication issue, because it's nearly impossible for somebody who responds to the medication in this way to stop the gambling behavior if you don't change or adjust the medications.
Excuse me, can you repeat that? What happens that causes that?
Yeah, the medications for Parkinson's and restless legs are medications that stimulate the dopamine system. And as you know, the dopamine system is involved in rewards and addictive behaviors. So for some individuals, these medications trigger a whole range of disinhibited behaviors or impulsive behaviors. For some, it's gambling. It can be sexual behaviors. It can be spending. So that range of doing things compulsively or impulsively. And for some individuals, you change or modify or stop the medications, which are mainly Mirapex and Requip, and the behaviors go away. And it's just amazing. They start the behaviors as soon as the medication is started, and the behaviors go away once the medication stops. For other individuals, it's not that simple. They may be at high risk, and the medication tips the balance. So even when you change the medications, you still have to engage in behavioral interventions to address the gambling behavior. So just as with people who don't have those medical conditions, there's a range of vulnerabilities for the addictive behaviors, and the medication has to be addressed, but may not be the only thing that has to be addressed, if that makes sense. I like this slide because it speaks to a point that's really important. With gambling disorder, to meet diagnostic criteria, you need to meet 4 out of these 9 criteria. To meet criteria for a substance use disorder, which means getting treatment, being eligible for treatment, getting insurance reimbursement, all those kinds of things, I only have to meet 2 out of these 11 criteria. That's because they combine substance abuse with substance dependence. Okay? So there's a much lower threshold for eligibility for the diagnosis and for services for substance use disorders and gambling disorder. We have, double. You have to be twice as sick or problematic to get any help for your gambling. So we still have work to do to be comparable to substance use disorders. But, as I've mentioned, that has an impact on who can get services and how sick and problematic this needs to be for you to get services, but also on research and prevalence data. So when I say, in Maryland, 3.4% of adults met criteria, if we lowered that criteria like we do for substance use, we might have double or even more the number of people who qualify as problem gamblers. So this has public policy, funding, reimbursement, access to services, all sorts of real life consequences. So our battle is not yet done in terms of, making sure we have comparability for gambling disorder. Okay, so high risk, evidence of high risk of gambling problems among individuals with substance use and mental health disorders. And we have findings that show that not addressing the gambling decreases treatment effectiveness and adds to treatment costs, which adds to all of our tax burdens. And early intervention and treatment clearly have been shown to work. So in the DSM, they make a clear statement that individuals with gambling disorder have high rates of substance use, depressive disorders, anxiety disorders, and personality disorders. We have clear research now from a variety of sources that from 1/3 to 1/2 or even more of individuals in substance use treatment can be identified as having gambling problems and meeting criteria for a gambling disorder. One study looked at the more severe the past year substance use, the higher the prevalence of gambling problems. And individuals with a lifetime history of mental health disorders have 2 to 3 times the rate of gambling problems. So these are people who are already getting services in our system. And as we'll look at in a bit, most of those issues are going unaddressed. In one survey from Ohio, the Ohio Substance Abuse Monitoring Survey, they looked at the connection between gambling and substance use and found that of their clients in treatment for a substance use disorder, nearly a third of them gambled more when they were using alcohol or other drugs. About 17% used more alcohol or drugs when they were gambling, and a bit over 15% gambled in order to buy alcohol or drugs. So there are multiple ways that these behaviors are interconnected, speaking to the impact that gambling can have on recovery from other disorders. And when we look at the effect on cost and treatment outcome, one study of folks with serious mental illness, schizophrenia and schizoaffective disorder, found that individuals diagnosed with these serious mental illnesses, the gambling was associated with higher rates of depression, more alcohol use problems, having more legal problems, and higher utilization of mental health treatment services. And this was associated with that recreational gambling, just moderate gambling, as well as problematic levels of gambling. And we'll see across a couple of studies that that at-risk or even moderate gambling group is associated with a whole range of other problems. And here's the real kicker. In a very large national comorbidity survey replication, tens of thousands of people, they asked about gambling. And while those who met criteria for lifetime diagnosis of pathological gambling, half of them with the diagnosis of a gambling disorder received treatment for substance use or mental health problems. And none of them had gotten any treatment for gambling problems. I mean, not even one person. I mean, that just blew my mind. So again, these people who are in our system, who are utilizing services, for whom those services are not being as effective as they might be, are not talking about the gambling issue, and nobody's talking about the gambling issue and how it affects their treatment and recovery. Also in the DSM, because of the research that we'll talk about, they specify that gambling is associated with poor general health and some specific medical diagnoses such as heart problems are more common among gamblers than the general population. Again, one very large national epidemiological survey asked about gambling as well as substance use disorders. And here's where they defined at-risk gambling as gambling just 5 times a year or more. And that was associated with these adverse health consequences, increased utilization of medical services, and increased health care costs. That at-risk group was more likely to be diagnosed with hypertension, get high-cost emergency room treatment, experience severe injury, obesity, have a history of mood or anxiety disorders, have an alcohol use disorder, and nicotine dependence. And you can see how the numbers jump. So we're not talking about 1 to 3% of the population. That at-risk group constituted 25% of that adult population that they studied. Now, those numbers start adding up when you talk about increased healthcare costs to our medical system because of this unaddressed gambling issue. Another whole group where gambling plays a role are those people who experience domestic violence or intimate partner violence. One study of 300 women who came to the emergency room, about a quarter of those were categorized as experiencing intimate partner violence. And when you looked at gambling and substance use, the violence was 10 times more likely if the partner were a problem gambler, only 6 times as likely if the partner was a problem drinker, but if you combine the two, violence was 50 times as likely. So a very, very volatile combination. Another study looked at just problem gamblers, and of people who had a gambling problem, 63% experienced past year assault, injury, or sexual coercion. Over half had perpetrated some intimate partner violence, and nearly 60% were the victims of some intimate partner violence. And again, if you combine substance use and anger problems, it just escalated. Some very volatile situations are getting or trying to get in between a gambler and his or her money. So oftentimes recommendations for treatment or in recovery groups are, well, just take control of the money. If there's a potential for violence, that can be a disastrous recommendation. So you have to be very cautious of safety issues in making that recommendation, or in telling somebody they have to become completely honest and tell their partner or spouse that they haven't paid the mortgage for the past year or the savings account is depleted. Telling somebody about the financial consequences can be a very volatile, risky, unsafe situation as well. So a lot of caution in those situations. Again, the National Comorbidity Replication Survey found dating violence to be increased with problem gambling, marital violence, and severe child abuse. So these, again, are people showing up in the legal system on domestic violence calls, and the police may be asking for or looking for evidence of substance use, but nobody's asking about the role gambling might play. Or in children's protective services, gambling isn't being asked about and might be a key factor in why a child is being taken out of a home because of the violence, but also because the child is being neglected. There's not adequate food or clothing or heat or housing because of the gambling problem. So lots of different ways these people are entering the system, more so than just coming in specifically for their gambling problem. So that leads us to screening. How are we screening for this disorder, or how are we asking about it to try to identify its role for those individuals already entering our healthcare and social support systems? Well, the good news is we've got a whole bunch of evidence-based problem gambling screens to use. The South Oaks Gambling Screen, the NODS, which is a DSM-4 based gambling screen, Gamblers Anonymous 20 questions. The Lie Bet questionnaire has 2 items. The Knots Clip, and we'll talk more specifically about these, has 3. The Perk has 4. Brief Biosocial Screen has 3. So very exciting if you worked in the field to get these brief screens that we could say, oh, you work in substance abuse. All you have to do is ask 2 questions and you'll find all these people. Here in Maryland, if you're in a publicly funded substance abuse program, you're supposed to be asking one of these screens. So let me just ask. Let me ask you to verbally respond. Does anybody on the call use any of these screening tools as part of what you normally do? And if so, which one?
Yes, we use it here, the live bet at the time of admission for any new patients. And periodically when we update treatment plans, we'll also inquire whether or not they gamble and get more information on how much.
Yeah. And what percentage of people would you say yes to either of the 2 questions?
I'll say out of the population here, we have like over 600, I'll say at least identified, at least 10 to 15% have stated that they do gamble more than they should, but they're not interested in treatment.
Yeah. Statewide, the average is 2.5% respond positively to any gambling screen that people are using out there. So, when you look at the research that shows you should be getting about 30 to 50% responding positively, in actual clinical practice, you're doing really good if you get 10 to 15%. In most places, in most states, you get about 1 to at most 3% positive response rates to these brief gambling screens. So typically they significantly under-identify. And you're right, even if they say yes, they're much less likely to have any desire to engage in treatment around these issues. So it's a process. The lie bet questions, that tolerance question, have you felt the need to bet more and more money? And the lying question, that's part of the diagnostic criteria. The nods clip, the loss of control piece, lying again, and being preoccupied with gambling. The nods perk, preoccupation again, gambling as a way of relieving or escaping problems, the chasing question, going back again to get even, and the negative consequences item are part of that. The brief biosocial gambling screen, withdrawal symptoms, the lying question, stated a little less obnoxiously, just keeping information from friends rather than lying to them. And the bailout question, have you gotten relief from your financial troubles from friends and family? In another study by Rachel Volberg and Rob Williams, they found 5 questions, and these 3 seem to do pretty well. Again, it's the tolerance question in 2 forms, gambling more and more to get the same feeling of excitement with larger amounts of money, or spending more and more time and attempting to control your gambling. And they found those useful items. So a lot of potential, but the bad news is that they don't tend to work very well in clinical practice and can give an agency the illusion of really addressing the issue. Well, I asked your darn questions. What more do you want me to do? I even asked them a couple of times. And no takers. Done my duty. That's it. I don't have to do anything else around problem gambling. Um, in Iowa, they did a nice study in actual clinical settings, and they got 1% who responded positively with the live bet, and up to a whopping 3% with the brief biosocial screen or the NODS clip. So just a lot of evidence, every place we've tried to do this, that you get lower rates. Compared to in Maryland, we did a research study in outpatient substance abuse and in a methadone maintenance clinic, and got almost 40% identified as meeting diagnostic criteria, and not just mild, but moderate to severe DSM criteria. But again, in actual clinical practice, you get about 2.5 versus 40% responding positively. So we clearly need to do something different, so that we don't give counselors the notion that, gee, maybe that's in those research populations, but my clients don't have any gambling problems.
How would you recommend that we, as treatment professionals, we screen better?
Well, that's what we're getting to. I think a couple of things. We talked about these barriers to acknowledging the problem. And so when you say, gee, you responded yes to this on my screen, is that, well, that was years ago, or I don't do that anymore, or it's really not a problem. And there's a lot of shame and reluctance to admit, either because I don't want to acknowledge I can't control this behavior, or I see it as the solution. Especially if we're working with lower income populations or populations that are marginalized, that don't have the same access to success as the majority population does, and gambling is their way out. Very hard to let go of that hope that I could get out of poverty, that I could get out of this marginalized status that I've been living in. Or they may just feel too overwhelmed. It's enough that I'm, referred here and I have to report to my probation officer, and I just want to deal with what got me here. Don't complicate my life for me. Service-centered factors, and this is where, counselors are concerned. People may have had bad experiences. I've had clients who've said, I told them about my gambling and they ignored it. Or they said, well, just say alcohol instead of gambling, or really minimize the problem. Some people don't want to be treated like an addict or a mentally ill person, and they can't get the services they want or need. So that's what this is about. It's, asking questions in the right way to reduce stigma, shame, and labeling. Another issue is just defining, as we did to start out, what we're talking about when we talk about gambling. If I ask somebody, who comes into my office, have you ever gambled? They'll say no. If I say, well, when did you buy your last lottery ticket? They'll say, well, on my way to your office. Because people don't automatically categorize things like playing the lottery as gambling. We had one lovely young counselor who told us after a training that she didn't hear a thing we said for the next hour after we said bingo was gambling. It just blew her away that what my church engages in is actually gambling. So first, before you ask these questions, you need to define very specifically what you're talking about when you talk about gambling. And we'll show you an example of that. And also, it's helpful to start out talking about things like just how often do you, rather than the diagnostic tip of the iceberg questions like, oh, are you a liar? Do you lie about your gambling? People are a lot less likely to cop to that than if you say, how often do you buy lottery tickets? Have you gone to the casino recently? And open it up there. One of our providers said if the first question I ask somebody is about problem gambling, they'll say no. And anything I ask them after that related to gambling is going to be an automatic no. So you don't start out by asking the most labeling, stigmatizing questions, but gradually approach this topic in a much less judgmental, accusatory kind of way. The other factor that I've learned about from counselors doing this work is just counselors may ask, based on workload, the length of our unwieldy intakes and assessments, and the pressure to get them done in one session, and thinking, well, this gambling stuff isn't why they came in here, so we can just jump over these. And just this past month, I was told by a lovely counselor, well, the way we ask it is we say, well, you don't have any problems with your gambling, do you? So we cue people what the right response is. The right response is no. And if you say no, we can both get out of here much more quickly. You've never lied about your gambling, have you, or wanted to spend more money on it? Whoop, nobody cares about gambling here. I can just say no to this and we'll both be happy. And counselors really have told me that's exactly the way we ask it, and not necessarily consciously and not trying to be a shoddy counselor. It just made sense to do it in that way to help focus on what the client came in there for. Another issue is, and again, heard this from counselors, if we ask about it and document that they say yes or screen positive, then we have to do something about that. Or when we have our JACO or our CARF survey, we will get dinged for not addressing problems. And we don't know what to do with it. So I think there's a lack of training. We say, here, do this screening, but we don't do an adequate job of training people. What do you do with that? And what do you do with that if somebody says, no, I don't think I have a gambling problem, as well as if somebody says, yes, I think I have a gambling problem. So we really need to put this kind of effort into training people, not just how do you ask the questions, but then what do you do no matter which way a person responds. So the approach we take is not just about identifying and labeling people who have, screen positive or assess positive for a gambling problem, but the much broader issue of how do you talk about the impact that gambling can have on recovery, health, and well-being, and supporting counselors for feeling competent and having the tools to do this kind of work. One interesting study found that general practitioners who were asked to screen for gambling just thought it was inappropriate, just out of the blue, to ask people about gambling. So they, with training about role playing, how do you ask the question, how do you deal with a whole range of client responses, from why the heck are you asking me about gambling, that's not why I'm here for, to, oh yeah, I've got this horrible problem. So either way, counselors and practitioners can be uncomfortable. So helping people know how to respond to that whole gamut of reactions. Comments or questions so far? Okay. So ideally, You start out saying, next I'm going to ask you a few questions about gambling. For example, by gambling, I mean buying lottery tickets, playing cards with friends, betting on sports, betting at the casino. Would you say you've done any of those things or any combination of those 5 times a year or more? And somebody might then respond, well, I don't really gamble, but I do buy lottery tickets a few times a week. And my friends and I go to the casino to celebrate our birthday. So you're kind of opening the door in a more gentle, inviting kind of way. So that one large comorbidity study used this as their definition, defining gambling. Then you ask that 5 times a year or more question. And if they say yes, then you can go on. And this happens to be the brief biosocial gambling screen that you can ask. And whether they say yes to gambling 5 times a year or more, or yes to any of these, you can give them some brief feedback, because yes to gambling 5 times a year puts a person at risk, and you might want to give them just some brief feedback on that and some educational information. And we'll show you what that is. And then you can go on to the diagnostic screen if they screen positive for one of those first 3 questions. And so counselors need to know that it's not your job to catch clients in their bad gambling behavior, but to really utilize motivational strategies to help clients be curious and open to a conversation about what role does gambling play in your life and recovery. And this brief advice and feedback has been piloted. Nancy Petrie in Connecticut did some research, and it's like a 10-minute protocol. So it really is something that's easily doable in a whole range of settings. So you might, somebody who scored positive on the screening, say, well, gee, you're in this range of probable gambling disordered person, the top 1%. You know, or if you say yes to gambling 5 times a year, you're in the top 9%. You know, while all of your friends may gamble just like you, a lot of people don't. So just want to give you that feedback. What do you think? I never thought of it that way before. I didn't realize that. You open the conversation. And then I just want to give you a little card, and this is our turtle card that we can send out to any and all, you know, that shows low-risk gambling, high-risk gambling, times when people may be at more risk for their gambling getting a little out of control, and lower risk ways of gambling, and guidelines for how to keep gambling fun and problem-free, setting a limit and sticking to it on time and money. If you can do that, that's likely not to be problematic. Only gamble what you can afford to lose. Don't borrow to get gambling money. Don't gamble with money that's meant for other necessities in life. And balance gambling with other recreational activities. Don't make it your only form of recreation and become preoccupied to it. So those are the guidelines. What do you think? Just want to give that to you. Boom, we're done. And you can go on. Would you like to talk more about your gambling, or do you have any other questions to ask me? And you can keep the conversation going. For those people in substance use, you know, give them the feedback. You may be at higher risk even if it's not a problem for you now. It can become more of a problem as you stop other addictive behaviors. Would it be okay with you if we monitored your gambling as you sustain your recovery from alcohol or drug use, just to make sure it doesn't start increasing? Would you like to set some limits? What role do you want gambling to play in your recovery? How do you see it helping your recovery? Or do you see any potential downside? That cost-benefit analysis. So those are the conversations you can have. Even if somebody says, no, I don't want gambling treatment, that's fine. But you can monitor it as part of their holistic recovery process. And I think that's a piece that's been missing largely in how we've worked with folks in mental health or substance abuse treatment. So rather than just screening and finding my gambling clients for me or giving them another label or sending them to another treatment program, talking with them, more broadly just about, how you want other things to be a part of your recovery. And are there high-risk gambling situations for your recovery? For example, clients have said, my mom wants me to take her to the casino when I go visit. And I want to do that because I know I've been such a pain in the butt to my mom through my substance use. But when I take her there, they're always offering me free drinks. And it's really hard for me. So that puts their recovery at risk. Or one person said, I went and I bought my lottery tickets and I won. And suddenly I had $100. And what I wanted to do was go around the corner where I used to score something and buy a little something. So that increased my desire for engaging in my previous addiction. So it can be connected in a whole variety of ways that people need to be aware of and be given permission to talk about. So it's beyond diagnosis and labeling and really working with integrating gambling throughout the treatment environment, having posters on your walls that talk about gambling and recovery, asking throughout the assessment, talking about in psychoeducational groups, alcohol, drugs, and gambling. It can be that simple, and knowing the appropriate examples to use. And even in the assessment, going beyond just throwing in a couple of screening questions, what I challenge agencies and providers to do is how might you ask in all the sections of your integrated assessment something about gambling. For example, in the section on medical problems, somebody has a chronic pain problem. You might ask them, well, what have you been doing to relieve your pain? Have you been taking more than the prescribed medications? Have you been resting and sleeping? Have you become isolated? Have you been doing other things? For example, some people say that when they're at the casino, they don't feel their pain. Has that been true for you? Clearly with financial, it's easy. If people have financial problems, what have you been doing to try to solve those problems? Have you been working an extra job? Have you been trying to cut back on expenses? Have you been buying extra lottery tickets? So you can just put it in there, and it doesn't add pages to your intake or your assessment, but it starts connecting the dots. And I've gotten to the point where I don't even care what the client answers. I just want the client to begin to be thinking, well, how is gambling connected to my medical problems, to my financial problems, either as a cause or a solution? Any family history, substance use, mental health, gambling problems. It's not just that the clients we're seeing have their own gambling issues. They may have family members who have gambling problems. One very depressed woman in a treatment setting, when we were asking folks about gambling issues, didn't say a word, and we finally asked her what she was making of the discussion, and she looked up and said, well, it's my boyfriend. And whenever he loses gambling, he comes in and beats the crap out of me. So it can be connected to in the families of folks we're working with as well. In substance use, any history of treatment for substance use, mental health, or gambling. If there have been periods where you've been abstinent from alcohol or drugs, did you see any increase in other behaviors, sexual behaviors, spending behaviors, eating behaviors, gambling behaviors? And just throw it out there. What do you do that helps relieve your depression or your anxiety or your trauma issues? Or what makes them worse? So all these ways of just putting it in throughout without being overly burdensome. So the key is really raising the topic of gambling and its role in your client's recovery in multiple contexts repeatedly over time. And what we found when we've done this is without, trying to make a client label themselves or acknowledge another problem, if you just put it out there as part of the conversation, people start self-identifying ways that it may be making their recovery more difficult or becoming problematic if you don't jump all over it as soon as they raise the topic. And really doing that in a non-judgmental and non-labeling way is really important to minimize that sense of shame and defensiveness or resistance that can be elicited in clients around this. Another example was this 34-year-old guy we talked with in a methadone program. He'd been abstinent from heroin and on methadone for about 4 months and said, I'm doing great on that, but now I'm having these cocaine cravings every month. And in his initial assessment, he reported only buying, occasional lottery tickets. But in the group we attended, he said he'd been spending $100 a week buying lottery tickets rather than buying crack, because when he would get paid, that money was a trigger. It triggered his cocaine cravings, and he said, well, isn't it better that I'm just buying lottery tickets rather than, buying and using cocaine? And we had to agree that it was. That's kind of a harm reduction strategy. You weren't going to get arrested, for possession of lottery tickets. It probably wasn't going to mess your health up as much as the cocaine was. It probably, wasn't at this point a biggest risk to the rest of his recovery. But we don't just leave it at that. It's like, well, what else might you be doing with that money? Is there anything else, that would be satisfying or supportive of your recovery to do with that money? And he acknowledged that he did, owe some child support, and he really did want a relationship with his son. And the less we focused on that buying the lottery tickets was a bad thing, the more he came up with reasons why he might be doing other things with that money. And often people in substance use recovery don't know what to do with the money or how to handle the extra finances they have when they're not spending their money on substances. So, resources. Here are resources, our website, mdproblemgambling.com. In the section on resources for therapists has problem gambling integrated manuals, examples of a problem gambling integrated assessment, all the screening tools. So there's a lot of information out there. We have other websites that have some posters, some little video snippets you can use in working with clients just to get the conversation started. So check out all of those websites. that may have useful resources in your treatment setting. And I think we've got about 5 more minutes. So any final questions or comments or things that you're going to take away from this training?
Lori, just to remind everybody that we have the BACC calls in case they may be interested in those as a resource. And if anyone has any follow-up questions to you in regards to the content that they'd like a little bit more time with you to answer those questions, and make one last pitch for the scholarship opportunity.
Okay. BACC calls are just kind of clinical discussion calls. Anybody can call in. They're free. They are which Monday of the month? The first Monday of the month, Carl?
Lori, it's the third Monday and the fourth Tuesday.
Thank you very much.
Good going, Michael.
Thank you. Yeah, you can check out our website or email me to get the call-in information and to register for those. But they're just to talk about anything related to problem gambling in your practice or questions you might have or anything like that.
I have a question. Can we get copies of today's slides? How would we do that?
Yes. What we'll probably do is put them in that resource section as well, as a resource for therapists. Or we'll tell you where we're going to put them on our website. Thank you all very, very much. Stay tuned for part 2 where we talk more about specific treatment interventions and how to engage folks both on the substance use and mental health side. Thanks all. Have a great weekend.